to be demonstrating how to properly fit the collar on the patient. So Dr. Krista is going to put the collar behind the patient right now. And we're going to connect, making sure, notice that the hair is up so that the hair doesn't get caught in the tracks. On the side here, these two tracks that's now being moved, if the hair dangles over them, they can get trapped. So make sure your patient, if they have long hair, to have it up. Now notice the collar is going back up. The first thing I notice here, the cheek pads are too high. So we want to lower those down a little bit. Dr. Krista will now adjust the cheek pads on both sides. Okay, and now she'll continue to track. And now the mandibular support. Now notice the mandibular support is right underneath the mandible. And the chin should be leaning right on. As she goes back, it's sitting there perfectly. Now, if we look at her from the side, you can see that the mandible adjustment, it has 4 different levels. So depending on the size of the face, you determine which notch would be appropriate. In this case, Jen needs the highest notch so that the mandible support is snugly under the chin. Here's the rearward tracks. They move rearward simultaneously. And if you look at her from the front, you'll see that the cheek pads are equidistant either side on the nose. Now, right now I'm looking at her nose a little bit to the right. So what we'd want to do is, Jen, turn your head a little bit to the left. Good. So you want to get that as centered as possible. And now that's in good position. We've had to adjust the cheek pads and we had to adjust the chin mandible support so that now she's secure. Now when the head is translated rearward, the chin will stay level so you get a true translation. Now she's going to turn sideways. As we look at her from the rear, we have the fulcrum in the rear of the collar. Notice that it's in the lower position. There's 2 positions for this. The lower position addresses the C5, C6 area, and the upper position is usually the C4 and 5. However, on tall patients with very long necks, you may want to take the upper position so that you get in the middle of the cervical spine to get a nice smooth lordosis. Now to advance the fulcrum forward, you turn the dial in the back clockwise. If you wanted to back the fulcrum out, you would simply turn it counterclockwise. So you can control the forward and aft movement of the lordosis pad on the inside of the collar by moving the dial to the right to advance the fulcrum and to the left to bring the fulcrum away. Why would I want to back the fulcrum away? Well, the answer to that question is if a patient has a large herniated disc or spur in the back of their neck, sometimes a strong lordosis pad will irritate them. In that case, back out the fulcrum as much as you have to so they can feel relief from the pressure, and then use the head correction portion of the collar to get the center of gravity of the cranium over the shoulders. Moving the head back over the shoulders makes a major improvement in the mechanical alignment of the entire spine. So both components of the corrections have benefit. Try to do both, and when you're doing your correction potential x-rays, set the patient up in the ideal alignment after you've taken the neutral lateral x-ray, then take the second lateral x-ray of the neck, same position, only with the collar on and maximum adjustment. Your patients will love the potential correction that they can achieve, and they'll be much better in following through on the program of care you've outlined for them. Thank you for your time.